Just going to go in the kitchen because Connie told me that I can't let anybody in the kitchen. So that's my wife Connie right over there with the gator. I can't believe we've been doing this 9 years, and it's been since 2019 that we actually had it live. So this is pretty amazing. Appreciate you all coming. We are on Facebook Live and YouTube Live and also Zoom. We have our distinguished panel members. And right after I give you some housekeeping things, then we'll start with our Representative Walsh and just kind of go down the line. And if you could just let us know kind of what's on your radar and what your thoughts are for this next legislative session or this next calendar year. I think that would be great. And then we're going to have presenters come up, and our presenters will be in order. The agenda, if you didn't get one, is right back on the back table. This is Diane. She is our timekeeper. She has a bell there. If she rings the bell, and she likes ringing the bell. But she has a sign for 1 minute and then 30 seconds, and that way we can keep the whole thing moving, and we don't have to get bogged down with long stuff. I don't have a lot to say because we haven't been together for quite some time, but please be respectful of the time, and otherwise, Diane, just keep ringing the bell. Let's ring the bell. And we'll begin with our presenters in order. You have the agenda. Presenters will, if you'll just state who you are and the organization you represent, you'll each have 5 minutes, and then 2 minutes for questions from our panel members. The intent of the forum is to inform our legislators and government officials about the work, the wonderful work that you all do in Lewis County. I will not be introducing each presenter. If you're the next in line, then just come right on up. And so I ask that after your time, after Diane rings the bell, that the next presenter just come right on up and tell us who you are and the agency you represent. Please remember that our panel members are here to hear from social service agencies. So be respectful. I know you will. This is not a place to debate or argue political ideologies. We're here to learn from one another. And we're here to understand some of the complications, some of the things that are happening in Lewis County that we all need to be aware of. So I appreciate you being respectful. At the end, that we will have time for audience members and people who are on Facebook and YouTube and Zoom to ask questions. And then, Dan, are you going to be handling that, or Caleb, if you see people that are asking questions? Okay. Yeah. Okay, we'll figure it out. So, and then we'll present those to our panel. So, does anybody have any questions before we start? Okay. Darin.Goss from Providence.
Okay, I am the warm-up act here, so Dr. Stride, thank you for putting me first. So Darin.Goss, I'm the Chief Executive with our Providence Centralia Hospital. We also are part of our medical group, which has locations here in Chehalis and Rochester and other areas in Lewis County. I just want to say first thank you to those online and especially those in the room, our elected officials, who have stood by health and health care. And as a leading employer here in the county non-government, this has, as you know, has been very challenging within the last couple of years. And we would have hoped to have been in a better place at the end of 2022 from the volume of flu, COVID, and all the other places. But we continue to see that play out. And it plays out in our emergency room in our hospital here at Providence, Centralia. I just want to say we have been experiencing long lines in our ED and others. So flu, COVID, RSV, delayed care continues to play a role in our patient volumes. And it also impacts our staffing. And staffing continues to be probably my number one priority here within the hospital. And we've heard some of that in other forums and the impacts to our staff. We know that our staff really do want to do a great job. And I can't tell you how proud I am as the chief executive of our hospital, our nurses, providers, engineers, finance, supply chain, everyone that comes together. Over 1,000 staff that come together to care for our community when it's needed. A couple things I just wanted to bring to the community's attention that we'll be focused on as a hospital, especially in the legislative session here, is just continued support for nursing education and the pipeline to grow our workforce within healthcare. Continued support around our Medicaid reimbursement and seeing increases for those patients that we care for. And then most importantly, support for our post-acute care centers, skilled nursing facilities, long-term acute care centers, where we are unable to discharge patients to right now because they also have some staffing challenges. So at our hospital, about 22 patients yesterday did not need that high level of care. And we recognize that that's also now impacting a bed for someone that does. So continued support around that would also be very appreciated. And then lastly, it is just an honor. We know we can't care for our community without partners. So that's our EMS, it's our fire, it's our police, it's our city councils, all of our Cascade, Valley View, and other community partners that help us do the work. And just on behalf of many, just thank you for that continued partnership with Providence, Centralia, and in our work here trying to care for the community. And so long road ahead, but we're dedicated and we'll continue to do our best. So thank you. And I think I beat the bell. So.
You did.
All right.
You have a minute 40 seconds left.
All right. So I'm available for questions, okay?
You touched on nursing education. Can you talk a little bit about struggles to either recruit, maintain staff, and staffing shortages, especially as it applies to rural communities like ours?
Mm-hmm. Yeah, I think so. We're very fortunate with Centralia College and those programs there, and continuing to look at how can we partner with growing our own, and then also growing with other entities, growing their staff. And that also takes preceptors and others within the unit to train. And so just looking at that entire pipeline of who has access to education and then the resources provided as we try to train, and train as fast as we can. Yeah, great question.
You talk about long lines and waiting and things like that in the emergency room. And my question is that the one thing that Centralia Police Department deals with quite a bit is assaults on nursing staff. And I'm curious what's being done to either prevent that or to protect your staff from actually getting assaulted and helping out law enforcement can be part of that.
Yeah, it's a really important question. So we have seen an increase in assaults against caregivers, especially in a polarizing environment right now with some political beliefs surrounding health and healthcare. So a few things. One is we've increased our presence, our security presence on the campus. Continue to educate both our staff on how to approach, whether it's behavioral health or other patient situations that may need a different response to keep both our caregivers safe, but also our patients safe as well. I think just continued partnership with our security teams and others, both from an education and then as we see the long lines in our ED, there's not everyone needs that high level of care in an emergency room. So we're continuing to look at to decompress those volumes? Are there other ways that people can access care? Telehealth or others who may not necessarily need to come to our ED, therefore causing some overcrowding. And so I'm not sure if I answered the question correctly, but we'll continue to explore, and our security team is well trained in this space, and appreciate that. And by the way, if anyone does want to do telehealth, 1 out of 5 of our primary care visits are done through telehealth, and that will continue to grow. And for those that are trying it, we're grateful because our providers and our patients do not have to travel for that. So. All right, I think I will end just on behalf of all those here. Just thank you for being part of this event, and happy holidays. So thank you.
Before you come up, I said that we were going to give our panel members a chance, and then I just went right on with the agenda. So we will start with Representative Walsh, who would like to tell us what's on your radar and what we're looking at for this next legislative session.
Sure. Thank you, Dr. Stride. I'm Jim Walsh. I am a state House member, House representative in Olympia for the 19th legislative district. At the last redistricting, my legislative district, which used to just have a tiny little sliver of Lewis County, got a lot more of Lewis County. Basically, the 19th now is all of Lewis County west of the interstate, as well as pieces and parts, a whole of 5 other counties. So we are the interstate out to the water, basically. In Olympia and in general, I consider myself a constitutionalist, and what that translates mostly into the issues we're going to talk about here this afternoon is, in my opinion, local control. I believe in derogation. I believe that the best policy decisions on things like the provision of medical care and certainly mental health care are best done at the most local level. And the battles that I fight on these fronts in Olympia are to try to get more policy decisions made by local care providers, and not so much by elected officials and bureaucrats in Olympia or in DC. I think your local community knows best how to deliver service and care to local people, and what we in Olympia need to be is empowering of local organizations to deliver care as they know is best delivered. I also deal a lot with law enforcement and similar issues and crime issues and judiciary issues, and that's a whole kettle of fish. But for today, I think my position is I like local control and local authority and do everything I can to make that happen.
My name is Sean Swope, County Commissioner for District 1, and during this legislative season, working with our legislators on the homeless issue that we have in Lewis County, you know that we are working on right now a night-by-night shelter that will be funded in a way to where we are able to keep that local control, and we're able to set the parameters with how that shelter is ran. The other thing that I want to work with our legislators during this session is funding that's coming into Lewis County, that we are given more opportunity to use those funds in the way that we see fit for our community. And one of those ways is with the mental health and the drug abuse disorder that's taking place in Lewis County, making sure that when we do have funding that's coming out for homeless services, it's not just for that, but it is braided with mental health treatment, it's braided with drug treatment, so that way we get good outcomes. One thing that I believe, and I want us all to be vocal on, is they're wanting to tie strings to the funds that we're getting to a housing first model, which I think is a terrible way to hand out money. What we want to see is built for zero. So we meet people where they're at. So if they need mental health treatment, we're going to get them mental health treatment. And we're going to find funding to be able to provide for that. If it's housing, then we're going to get them housing. But if it's a drug disorder, then we're going to work on getting that solved as well. And so those are things that I'm highly focused on and wanting to make sure that we take care of all of our citizens in Lewis County.
My name is State Representative Peter Urbano. I represent the 20th Legislative District, which is, you're sitting in it, but it's it's South Thurston County, Lewis, Cowlitz, east of I-5, and Clark County down through Ridgefield, almost to Vancouver. It's a pretty long district. I have the pleasure of, I think this is my 9th out of 9 Cascade Community Forum that I've sat on the panel. As a city councilor here in Centralia and now as a state representative, I'm a business owner, I'm a local attorney, but most importantly for me, I'm a husband and father. I think that's what guides me in terms of what I do and focus on in Olympia. It guides my decision making on what I think is best for my community, what's best for my children, what's best for their friends in our neighborhood, and to try to look at things pragmatically. I sometimes look at things through a lens of what I want it to be rather than what it really is, and I try to work with our community partners. Many of you, I look around the room, I've worked with for a decade or more on issues, whether it be addiction or behavioral health or Samantha in the court system as an attorney working with youth, and I'm looking forward to reading through your folder here and touring your new facility in Centralia. It's something that I think we have to do together. These issues aren't partisan issues. They're not even liberal or conservative issues. These are human issues. And we're not going to solve them. We're not going to find real solutions alone. Even though we all think we know the answer, I can tell you we don't. We have to do this together, and we have to do it as a community. And that really is a magnification of what Representative Walsh said. This is about local control. What I have seen, this is going into my second term in the House. So for the first 2 years, I was always, or before 2 years ago, I was always an outsider looking in. And what I knew going into this, and it was emphasized as a House member, is that cookie cutter, one size fits all programs passed by our state government are not real solutions. That we need to listen to you, which we're going to do, and we need to continue to work with you throughout this process, because what works in Seattle or Yakima or Spokane may not work in Centralia or Castle Rock or PL, and that we need to work with our providers and our service providers and our community members to find out what's really going to work and what's going to represent our value system. So that's really what I love about this forum, and I thank Cascade Community Healthcare and Dr. Stride for putting these on, because they're invaluable as we go into the legislative process in the session come January 9th. So thank you very much.
Okay, well, my name is Stacy Denham, and I'm the Chief of Police with the Centralia Police Department. And as I get up here and I started looking around, I feel like I'm a little outnumbered. I'm the only non-politician person up here, so bear with me. I'll try to keep this a little short. So one thing that I look at is partnerships. And one thing that we've lacked over the past 30 years that I've been in law enforcement in this area is partnerships with Cascade Mental Health and with the hospital. And even though we've had some relationships and some partnerships that are on the fringe, they weren't necessarily built and deeply rooted. So I know that when I became the police chief a couple years ago, and just a little bit before that, we started building those partnerships with Cascade Mental Health. And this is something that's pretty unique in a lot of areas, and I think it's even going to be more unique in Lewis County. With Centralia Police Department, I think is one of the agencies that really truly is leading the way with the communications and being able to set partnerships with Cascade Mental Health as far as the Recovery Navigator program that we've just recently gotten started, and the crisis unit, the SUD, and we're starting to really start to dip our toe into that area of partnerships, and we can actually already see a change in demeanor, opinions, attitudes toward how people that are struggling on the streets with either mental health and or drug addiction is being handled. And I know that one of the great partnerships that we have currently is with Chris Sweet over at the jail, doing an outstanding job over there. And as we move forward with that, the one thing I really look forward to is that program growing and being able to help more and more people as we become more solidified in what we do and how we do it. So if you on the fringe of this and you haven't seen how these things are happening, it's an amazing thing, because in my career, there are people talking and partnering up with agencies that I never thought would partner up before, or there's been too much red tape so that they couldn't partner before. And even now, we're still running into some of that, and I'm hoping that there's legislation coming through that's going to make that easier so that we can communicate a little more freely, because the bottom line is that we need to help the people who need to be helped, to give them a hand up rather than just hand out. Because I think that's one of the most important things that we can do. So with that, I'm looking forward to continuing those relationships and supporting any legislation that can go through that's going to allow those relationships to continue and the more people that we can help. So thank you.
Well, good afternoon. I'm Sheriff Rob Snoz, and I don't know if this is my 8th or 7th year here, but I want to tell you in reference to Cascade Community Healthcare, I want to thank Dr. Stride and his whole staff. We have been in partnership since I've been sheriff for over 8 years, and we'll continue that. Over the years, we've had these discussions, and I want to tell everybody in this room, thank you for being here. It shows your compassion and your want to change Lewis County. Lewis County is one of the greatest places. We say we want to keep it local. We've done some amazing things in Lewis County that we can hold our heads up because we're doing it better than a lot of other communities. The relationships that we have, whether it's dealing with Recovery Navigator or mental health and other organizations, we've all been able to sit at the table, have a conversation, sometimes difficult conversations, but we've never left the table upset. We've always come up with what we can do better. This community deserves everybody in this room to come together and find solutions, and we're doing that. You know, in Lewis County Jail, I always say we're the largest mental health provider. That's true. It's a true statement. But the partnerships that we have, whether it's medical, whether it's Cascade or other working with veterans and other affiliates, we're working together because our goal at the Lewis County Sheriff's Office at the jail, when we bring these people in, our goal is to make it that when they come out, that they have the opportunity to be a success story, like all of us want them to be. All of us in this room pray for success, and everybody that has mental health has drug addiction. Veterans don't come to jail because they said, I want to go fight for our country, and then come back and say, I'm committing these crimes, I'm going through these crises. We have to recognize that. We have to recognize these individuals. No one chooses to say, I can't wait to have mental health issues. But that's what happens sometimes. Whether it's with drug addiction, mental health, whatever the case may be, we're running into it at the jail. And the costs are getting higher. I mean, we struggle to find ways, and working together with our county commissioners and legislators to find funding that we can continue is priority. It's paramount. Because I want to tell you, we are the success story. You just don't hear it enough. All of us in this room are a success. And I want to thank everybody for being here because this community can come together. The partnerships we have is incredible. I look at people, I'm forgetting agencies and names, you know, the health department and Mindy and everybody out there. I just want to say thank you, and JP and everybody. But this is a great community, and I look forward to a robust discussion because we can solve Lewis County issues. So thank you.
I'm Ed Orcutt, also a state representative in the 20th District. I think I might have missed one of these, so I think I'm only at 8 instead of 9. Over the years, I've spent some time with Dr. Stride, toured the facilities that we have here in Lewis County. Met with him. I've received a number of emails and had a number of communications with Dr. Stride over the years. And my attempts are to try and understand what the needs are, what's preventing you from implementing solutions that work here. I agree with some others who have said, one size fits all doesn't work. What worked in Seattle doesn't work here. What doesn't work in Seattle oftentimes doesn't work here either. So, we want to make sure that we don't just put certain mandates down or directives on how to do things and then walk away and think the problem is solved. Oftentimes there are unintended consequences to things that we do. We need to constantly be reevaluating and constantly communicating and receiving communications from people that are doing this on the ground. I'm a consultant coordinator. I don't have background in mental health and substance use disorders, so I'm relying on the experts in the room to better understand what's going on, what the needs are, and how we can empower you, enable you, assist you in doing the things you need to do to serve the citizens that we all serve in one way or another. We serve the citizens here in Lewis County. So, my focus tends to be on transportation, on tax policy issues, and on natural resources and agriculture issues, because those are the 3 committees I sit on out of 20 committees in the legislature. So hearing from those of you who are doing this on the ground, what you're seeing day to day, we have people that come to Olympia and advocate on behalf of all mental health organizations around the state. But what's happening with mental health in one area isn't necessarily what's happening in another, or people are affected in different ways. Seattle has a lot of mental health providers in a very small area. Here we've got clients spread out all over the place that have needs and very few resources for them. It's a totally different scenario here. And understanding what those differences are and trying to help you to navigate the systems that we have in place, or to change the systems we have in place to account for the differences, is the type of thing that we need your help to do. So I don't want to spend a lot of time talking to you and telling you things, because we're really here to listen to you and understand what you're seeing on the ground and trying to get a better understanding of what we can do to help solve the problems that you're facing every day and trying to serve your community. Thank you.
I'll change name tags. Senator Braun couldn't be here, but I'm Senator Jeff Wilson from the 19th Legislative District in the southwest corner of the state. So I've never been here before. So those that say this is their consecutive year, this is my 3rd year of entering as a senator, but I've never stepped one foot on this facility before. But Dr. Stride, your opening comments said that the presenters had a lot to say. And Representative Orcutt just summed it up, as we have as legislator, so we have a lot to listen to. So regardless of where the district lines are at and partisanship, we know that the issues are escalating to priority. Substance abuse, substance use, the impact on Providence, emergency rooms really are not chronic treatment centers. And even in an acute basis. And it was interesting to hear the word used, delayed care. We are understanding some of the struggles that have gone through, and COVID has only elevated just how challenging these times are. Such as delayed care. It's a word that I didn't even speak of 2 years ago. And it's really part of the reason a pandemic has somewhat kept us away, Dr. Stride. But I will say that again, the lines there's no blur, there's no crossing. It is an elevated level for all of us. We have the numbers. We're smart people now, or smarter. We know that overdose deaths, they're the leading cause of those that are younger than age 65. We know that mental health affects everybody. And the one thing that I was most intrigued about, back to you, Darin, is that your talk about telemedicine. Everybody should be connected now. And I think we need to capitalize on that. The legislator, I certainly am very supportive of that, which makes those chronic problems more accessible on an acute basis. I mean, right now, living in the now, the moment of the now. And the one thing I'll close with, for us business-ended people, is that this isn't a Monday through Friday job. This is a 7-day-a-week, 24-hour-a-day issue that I can assure you that the legislature is very much prepared to listen to and to react. So nice to meet you, and Merry Christmas to you.
And I saw that Senator Bruhn came in, so we can bring the placard back around and. Yeah.
All right, well, good afternoon. First of all, I apologize for being late. I had another event that overlapped with this, so I just finished that. Actually, I didn't finish it. I just had to leave because I wanted to be here. I'm happy to be here. I'm John Braun, State Senator for the 20th District. I don't know what the question was, but I can tell you, I certainly, whatever the question was, I come to this event and have for a number of years simply because it gives me great insight into what we're doing already in our communities, across a number of different services, and what you need to continue to do the good work you're doing. So it's a valuable source for me to understand the positives and the things we can work on together, and where you may need state support to get things done. So I'm just here to listen. I look forward to hearing what you have to say and having a good conversation. I'll stop there.
Slides too. Great. Hey everybody, my name is JP Anderson. I'm here today as the CEO of Choice CPAA. This is my fourth different entity I've represented at a Cascade event. I started off as a Cascade employee, spent 12 years here, went and worked for Superior Court as the drug court manager, went and worked for public health, and now I'm here as the CEO of Choice CPAA. What we do, our company was started in 1995 by healthcare leaders wanting to draw from cross-sector members and partners to take on big projects that couldn't be done by any one entity. Providence had a big hand in getting that started. Other hospital systems, public health, behavioral health agencies, FQHCs, federally qualified healthcare centers have all joined, next slide, have all joined the cause. And we're two entities. Choice Regional Health Network has been around since 1995, but CPAA was started about 6 years ago, and it was started to become an accountable community of health. So the Washington State Healthcare Authority applied to the federal government to get federal Medicaid dollars to use them in new ways to try to make the changes and seed the kind of projects that we're talking about wanting to have. And to do that with more of a local focus. And so 9 accountable communities of health were started in Washington State. You can see here our list of CPAA board members as well as our Choice board members. We also have lots of partners that aren't on our board, many of them in Lewis County. I'm not going to be able to go through all of our projects in Lewis County right now. I want to talk about what we're hoping to do in the coming year. But if you want to hear from me, have me come talk to you, your staff, come to our office and meet with me, have a conversation. You can call me. I'll put my cell phone number up there. People can call me whenever they want, ask a question. I'd love to do that. This is a really special room. This is a really special place with Richard and his team. I've worked with everybody just about on this panel. It's sometimes in boring long meetings, sometimes hold up, waiting to see what the floodwaters are going to do and how we're going to get people safe on a roof. I've been in this community for a long time. I live in Thurston County, but worked here my entire professional career, and I believe so much in what Lewis County can do, and I believe we can be a part of that going forward. Next slide. So, as we think about what an accountable community of health does, and as we think about making changes to help improve people's health outcomes, there's a theme and a conversation that we're really going to be working with all of the 7 counties in our region in the next year on, and that's a new partner agreement that focuses on a couple things. One, it focuses on, we hear about let's move upstream a lot, and as you see here, if we want to improve well-being, we can't just provide support only when people are in crisis, only when they're having a drug use issue that's not being treated, not only when they're homeless. You've got to look at what are the systemic pieces that you can do to make those services, make those community assets available before that. All well and good, right? We need to talk about that and understand that there's a lot of work beyond that. So if you think about where we need to go, and you think about going upstream, that's the community impact. Those are strategies, tactics, laws, policies, regulations that create community health for all people, that create healthy communities. Oftentimes we're spent going from one open sore of a problem or highly visible problem to another, but we never get to have the time to pick some strategies together on the upstream interventions. Kind of further downstream, you think about the individual impact. So, patient screening questions about social factors. Someone goes into the hospital now. Yeah, we're starting to look for ways to cue in and to provide better wraparound care for individuals. That's kind of the next level down. And then at the end, kind of here downstream, these are immediate medical interventions. So you can think about this a lot of different ways, and depending on the, my goodness, 1 minute. That bell was created for me, by the way. We need to go upstream. So how do we start to conceptualize that? Next slide, please. This is the for the next year. As you can see, there's a lot of different things that create a healthy community, and right at the middle of that is a sense of belonging and civic muscle. And that's what this community has. That's what you guys are talking about, and that's actually what informs all the work we need to do. So local control, yes. Local control and interventions created locally are what work. That's what worked in the jail when we brought behavioral health services in there. That's what worked in every intervention I've ever been a part of that worked, is a sense of ownership by the people that created it that it's intended to serve. Next slide. There's a new waiver coming out. Healthcare Authority is going to be applied for it. Legislators will hear about it. Happy to talk more and explain that. There's not a financial request from state money, but there is a spending authority element to it. I'm happy to speak to any of you about it anytime. It's to develop community hubs and health equity. Turn off, 30 more seconds. Okay. And then, last slide. We're going to be hiring an executive director for Blue Zone activation in Lewis County to do long-term health strategy projects. If you want to learn more, talk to me afterwards. It's a really exciting project. Questions?
I'll ask you, JP, because I know you want more time. I can see you're not ready to sit down yet. You don't want to.
Very early.
So, of your presentation, the one thing that I think is part of it, but wasn't specifically mentioned, was preventative health. Preventative health, like keeping people. We've talked about this before. Keeping veterans and seniors in their homes is not only the right thing to do, but it's cost effective from trying to rehouse them if they lose their housing. Can you talk a little bit about your work in the preventative side?
Absolutely. So, prevention, we think about substance use prevention easily, and people are familiar with substance abuse prevention programming, and it's fairly visible. But when we think about the vital conditions, and if we think of that like a menu that we want to spend our resources in purchasing, there's a response, which would be a homeless shelter to an issue like housing, and then there is a more preventative measure to that, and I know, zoning issues. Building requirements. I'm thinking about the things that inhibit building right here in Centralia that we've looked at, and just having the financial resources to do that and the infrastructure to support it. So many of these problems we end up looking at from a response side, and we need to, and you can't totally ignore that, but how do we start driving funding and strategies up in prevention? It's true in substance use, it's true in every program we want to have, including behavioral health. And that's what ACHs are uniquely able to do with those Medicaid dollars in these projects, is to use them for creative projects to try to transform health outcomes for folks.
And I know You don't want to sit down, so I'm going to ask you one more. I know we're here to listen, but I would just make the comment. I would love to have more involvement from organizations like yours when we're talking about Growth Management Act, we're talking about zoning, we're talking about building codes, to be able to build to impact preventative and be able to build more. So, I mean, I know that sometimes is not a natural relationship, but I would love to have more input from you and organizations like yours on when there's things that come through committees on Growth Management Act and additional building regulations to talk about how that might impact the behavioral health side or the addiction side or veterans and seniors and preventing them from losing housing or to build housing for those people. So
absolutely would love to participate in that. We serve 7 counties: Thurston, Mason, Lewis, Grace Harbor, Pacific, Wahkiakum, and Cowlitz. And so we have similar local form. We have local forms in each county, and having a way to kind of regionally leverage that voice and that concern is something I'd love to talk with you more about how to do that.
Thank you.
Is there any time left for me? Don't stir it again. My name is Samantha. I'm with the Youth Advocacy Center of Lewis County, for those of you who don't know. My job is as the Child Forensic Interviewer and Clinic Coordinator. We're a satellite center of the Monarch Children's Justice and Advocacy Center, which is a nationally accredited child advocacy center. And we are a program of the Community Action Council of Lewis, Mason, and Thurston. As a forensic interviewer, it is my job to conduct forensic interviews of children when there have been criminal allegations of abuse, such as sexual abuse, physical abuse, neglect, maltreatment, torture, exploitation, trafficking, to name a few. We provide a child-friendly and trauma-informed setting, and the interviews follow a legally defensible protocol. We partner with every law enforcement agency in Lewis County, the Prosecuting Attorney's Office, CPS, on child abuse investigations, and we support other agencies from other jurisdictions. We also provide on-site sexual assault medical exams from Providence St. Pete's Child Maltreatment Center, and we do not duplicate any other service in Lewis County. We thrive on being able to refer our families that come into the services that are out in Lewis County and in other areas. I've been speaking at the event for a couple of years now. Normally I come and I share sad and often staggering and depressing demographics of our families and the children that we serve. And I'll share a few of those demographics this year. Like this year we've served 157 children so far, and that's the highest number in our agency's history. However, I do want to focus on some of the amazing work we've been able to do this year because of the support that we've received from our community. Our biggest news is that the Board of County Commissioners granted our agency funding to hire a full-time care coordinator, and in October we hired Katrina Wolf. This is a game changer for our agency. It will allow us to help provide wraparound services for children and families that come to our center and provide a comprehensive picture of what is happening with our local families who are experiencing abuse on multiple levels. Since October, when Katrina started, the time spent with families navigating the complex systems, helping coordinate resource referrals, and following up with families after the initial forensic interview has tripled. Working alone as a forensic interviewer for so long, I could not help families or children find resources they need, let alone actively connect them to those resources and follow up with on those connections. Another statistics I want to share that we've been able to gather since Katrina started working with us is that of the non-offending family members that have come with the children to the center, 88% have experienced intergenerational abuse. This information helps us understand more how those caregivers can handle the stress of navigating to help their children and what steps we can take to make sure that they're accessing resources to navigating the complex system and also addressing their past trauma as well as their child's current trauma. The experiences that we'll be able to track and share now that we have a care coordinator will have a broad community impact. We hope to share and use that information to create a better coordinated response for Lewis County families that will result in a safer and healthier community. Some other exciting news, we received a $10,000 grant from Twin City Rotaries to help pay for supplies and training for the Darkness to Light program, which is a child sexual abuse community prevention training. We are also collaborating with United Way, which has helped set up monthly Darkness to Light trainings at Centralia College every third Wednesday from 6 to 8 starting in January. This is a huge deal because we've set a goal to having 5% of Lewis County adults trained in child sexual abuse prevention by 2025. One more bit of news. As of October this year, with the help and support of the Prosecuting Attorney's Office, we have set up a child sex trafficking investigative task force. This task force includes the Prosecuting Attorney's Office, the Sheriff's Office, Centralia PD, Chehalis PD, CPS, Providence Sexual Assault Medical Team, Juvenile Justice, and the Youth Advocacy Center. As a team, we're heading to training in Memphis this January on how to better respond to these cases within our community. And later next year, we plan to implement a community resource response task force to provide a comprehensive collaboration of resources that will go just beyond trafficking cases. I have outlined in the packet a plan that we have in implementing this program. I don't like offering really bad news without a solution behind it. And so I have solutions. We're working closely with Juvenile Justice, creating intake to recognize red flags for exploitation victims, and also developing a training program to implement with every child that goes through the detention center on internet and exploitation safety. The only ask that I have this year is that for everyone at the panel that comes here in the center, and please look at the information in our packet. I always like promoting lots of stuff.
So, Samantha, I just want to acknowledge what a great job you and your staff have done. I mean, since you've been in Lewis County, you have done such an incredible job. I was glad to see that the commissioners this year were able to provide some funding, because I know in the years past we were worried about some of the funding issues that were coming your way. One of the questions I would have is this funding, is this sustainable as we go into the future, or is this a one-time deal?
I am doing everything I can to make it sustainable. This will allow us to create a, Katrina's taken a lot. I mean, she's doing so much that allows me to create a advisory board with community members. It's not a governing board, but this year I hope to create that so that we can start fundraising and community outreach. I can't do that in my position, have never been able to do that, but now we can start that. I'm looking at every avenue. I'm bag barring, stealing, and whatever else I do.
Well, I would ask that you meet all these folks here at this table and start asking for funding, because this program that you have is an incredible program. And folks, if you don't know, youth advocacy, we see, Chief and I see children, and law enforcement see children that have been sexually, physically, mentally abused. And for them to go through that, when they go to see Samantha and the things that they are able to do and help provide the resources for family, because a lot of times family doesn't know what to do. Here they have a child who's been sexually or physically abused. What do we do? How do we do that? And I will tell you that the program that Samantha and her team does is so incredible, so important, that I would encourage all of us to think about, when we look at funding sources, what groups do we need to fund, who needs funding, and I know everybody does, but this is a program that I think we should all invest in our children and what she and her team is doing. So she didn't pay me to say that. But I want to thank you and your team for everything.
I have a question, Samantha. The issue of human trafficking, particularly the trafficking of young girls, is something that Olympia tries to ignore in policy. I just want you to expand on what you see here in this county in terms of trafficking of minors, trafficking of children, and how real it is an issue here and by extension to the whole state.
Well, we do a lot. I know our law enforcement works really closely with Homeland, FBI on a lot of these cross-jurisdictional cases. As far as locally, a focus that we've really started taking is our interfamilial trafficking. That's a start, and I put some statistics in there. That's just one piece to creating the problem that we have with runaways, and then the delinquency and the detention and their survival. And the runaways' survival leads to the trafficking and leads to this sex survival tactics. And so I think really this year creating that response, community resource response, what I kind of did, I've looked at a lot of task force, and they combine the community resources and the law enforcement investigative side. I split them up. investigative side has a very clear role that they need to play to be able to handle these cases. The community needs to come together and respond and have care for these children. And so I think, like, Katrina is going to be that liaison between the community and the investigative so that we can make sure we're wrapping around these families, and I think that's going to be a big thing for us. But, I put some myths and stuff around, the trafficking and what that really looks like. But I think for this year, and we've really talked about it with prosecution, is that interfamilial aspect and what it leads to and what that looks like in the broad picture.
Can you talk about staffing that you still need and funding that goes along with it?
I'm so super excited just to have one person. I haven't even looked that far yet.
When you came to the commissioners, you need more staffing to make sure that you're touching consistently youth in our community, because you might meet with one person and then it might be a couple months later before you get back around, but by a couple months then they've maybe fallen off the grid and you don't know where they're at.
Well, I think if you're looking at how a child advocacy center should be run, is it should be a centered program where you have forensic interviewing, you have care coordination, you have specialized law enforcement working on it, you have special prosecution working on these cases, you have mental health on site, and they're all co-located and they're all dedicated to these types of cases. Ideally, that's what we want here. That would be like a 10-year goal, if I had to say. Right now, just with having Katrina and that follow-up piece that I've been missing, we've tripled our time that we've spent with families. We are tracking every single type of demographic, of trend, of anything that we're seeing, we're trafficking, so that we can start sharing with the community all of these things we're seeing and actually finding out where are we missing pieces when it comes to responding to these cases. What kind of staffing do we need in the future to grow? So, but I couldn't answer.
No, that's good. And I just want to point out to our legislators that on programs that actually work and programs where we want to support where our seniors, our veterans, our youth, it is hard to find funding. But then you have billions of dollars being pumped into homeless services, and we can't get services to our youth and to our veterans and to our seniors. And somehow we've got to be more creative in getting revenue to these different areas, not just focused on homeless issues. Because if we can keep them from becoming homeless, then we can better use that money on other areas to make sure that that doesn't happen.
If you want my opinion, it starts with our children. We fix these problems by taking care of our children. I'm just biased, I work with you. So. But I also would like to say that I think, and I've said this every year, we should be asking every single person that we have homeless in our community what happened to them in their childhood. And what could we have done differently to make it so that they aren't where they're at now. Because I really think a lot of it starts there.
So just real quick, I also want to thank you for the work that you do. My detectives speak extremely highly of you and everything that you've done and the things that you've proven, and you've proven that they work. And that's amazing. So my hat's off to you. But one of the things that I've noticed over the past several years of my career that life has gone away from the traditional way you'd see prostitution and trafficking, things like that on a street corner and whatnot, and it's moved to social media. And I know it hasn't been that long ago that the laws have changed. It's making those investigations a little more difficult, but the way that we do those, we actually be able to pull these people out of the dark web and get them out and expose them and be able to arrest them. Is there something that maybe the legislators can look at as far as potentially changing those laws to make it easier to do these type of investigations from your point of view?
I take more of the preventative approach to that. I don't know, and I can't articulate all of the laws that are out there at this moment. It's too overwhelming. But I think, after talking with a couple special agents who've been into our local schools and talking about exploitation, we need to approach this like we do with drugs and like we do with drinking and driving. We need to have education programs on safety, what exploitation looks like, what alternatives are out there. And I think we need to look at it from a different approach, because even as we're going into like the juvenile justice, what do we do when we find out we have this information? Because we have children who are not going to disclose because they're afraid of a lot of other number of things. And so that's one of the reasons that we're trying to set up the training for every kid that goes through detention on these topics, so so that they might not believe us or they might not listen to the first time, but if they're repeat offenders coming in, they're still going to hear the same story. We're listening to you. We're here to provide resources. We want to give you help, and you're not going to get in trouble for telling us that you did these things to survive. And so I really think changing and making these investigative and the laws better is the preventative side. That's a lot of questions. I actually, if you weren't going to ask me questions, I have a list of questions that I was going to ask.
She sent me an email and she goes, can I ask them questions? I'm like, let's do it.
You can send them to us, though.
I will put that email on.
Good afternoon. My name is Meja Handlen. I am the Director for Public Health and Social Services. Meja, you here. And you here to hear us. So thank you for doing that. That is an introduction I often do with a lot of people who haven't met me or aren't familiar. But when you're taking the time to sit in a room to hear what community providers are doing, you're here for us. And Public Health and Social Services is here for the community. We do homeless services, but we also do some other amazing programs. And one program that we really want to highlight today was ARPA funding allowed us to start building and looking at what happened to the community during COVID. And what happened to the community during COVID was isolation, social media, and polarization. So that social media piece really hit some of our youth very hard. Not being in schools hit our youth really hard. Personally, I've been directly affected by social media reaching into a young person's life, them not feeling supported good enough, so they sought to self-soothe, self-care. That ended up in that person dying. Everyone in this room probably knows someone who has tried to self-care, didn't know who to reach out to. Public Health and Social Services feels very strongly about prevention. So when we were asked by the VOCC, hey, what money might be available to help fund the youth advocacy wraparound services, we stepped in and said, yeah, use some of our funding, because that wraparound service, and I am thrilled that it is Katrina, she is a community member, a mother, a person who strongly believes what wraparound service means doesn't mean smothering the person, it means meeting them where they are. What do you need? I'm not here to tell you what to do, but you tell me what you need. That's the kind of services public health wants to provide. And so I am mixing out a little bit, sorry Mindy. I wanted the person kind of who was instrumental in helping us get this new program that is going to be taking off soon, and it's a youth mentoring program in conjunction with juvenile justice. And so Lee Montgomery was here, and for those of you who don't know Lee Montgomery, he had one of the most amazing mentors in the world, his mom, Bonnie. As a PL resident, Bonnie was the difference in the school district for many children because you could talk to her anytime. She would literally give you the shirt off her back and probably make some jokes about it. But Bonnie was a great person, and when she passed, they did something amazing in PL. It said, "Be like Bonnie," and it was on the side of this building. And so for a while, every time you drove by, you saw that reminder. That's what mentorship is. Some kids in our community don't have positive mentors. We have mentors in this room. And I'm looking at people in this room who jumped into icy cold water at Lake Mayfield to help support Special Olympians. I mean, we have people here who want to be mentors. Now we have a formal program that is kicking off. So Lee Montgomery is going to tell you a little bit more about that.
Thank you, Lee Montgomery, Lewis County Juvenile Court. We're real quickly on this. I know I've only got a couple minutes left here. So discussions for a mentor program began before the pandemic did, right? And so people came together and said, there's a huge mental health issue going on with youth. It's on the rise. What are we going to do about that? And the pandemic just kind of magnified that. We saw it coming out. And so according to the 2021 Healthy Youth Survey, nearly 1/3 of 8th graders and 10th graders reported feeling so sad and hopeless that they gave up being involved in anything. Okay, so 1/3 of that. A quarter of 6th graders reported that they felt so sad that they were considering suicide. It's pretty crazy. So Lewis County statistics for the juvenile justice, 14% of the youth that have come through our system have attempted suicide. That's crazy. 49% currently admit to using drugs and alcohol. 78% were very unlikely to graduate from high school. So resources from numerous distinct resources say that the number one factor that makes a difference on a youth, stabilizing their emotional and mental well-being, the number one factor is a positive adult involved in life. A positive adult involved in life, right? Back in March of 2022, a bunch of people got together and I'm jumping real quick here. Said, what do we need to do to make a mentor program happen? So we started discussing that. We found out there's an opportunity to present and request funding from the county commissioners. We presented that for our youth mentor program, and the county commissioners approved that. See, research shows that mentor programs make a lasting difference. And there are some out there that don't succeed, and then there are some that do. And we want to be one of those that do. And so we're looking closely at the best practices that make a difference. And so we're putting together a manual making that happen. Our mentor program is going to be county-wide. It's going to be open to all youth, not just those coming to juvenile justice, but all youth. And referrals will come in from schools, come in from service providers, come in from parents, or even self-referral. Kids can self-refer them. Yesterday we spent all day. We interviewed 8 people to be our youth coordinator. We narrowed that down to 3. We're going to invite those 3 back for a second interview next week. So it's happening. In March, we're going to be beginning our recruiting and training of our first cohort of mentors. In June, we plan to launch our first group of mentors and mentees and get that going. And we're planning and fully expecting this program to be successful and impacting, and we're hoping that we can be an example to other counties and other states. And if any of you are interested in being a mentor, please talk to me. We'll push on the list. All right, please. Questions?
Good afternoon. Just this. Good afternoon, everyone. My name is Trinidad, Medina. I am the Chief Executive Director with Great Rivers ASO. We began operations in 2020. So we're fairly a new organization, but the Great Rivers name has been in the region for quite some time. I have a few slides here for you with some data. I'd like to show you some of the work that our crisis teams have been doing. So why don't we advance to the next slide? And, oops. It's not supposed to look like that. Maybe the next slide. Okay. There we go. A little bit about Great Rivers. We are one of 8 administrative services organizations statewide. Our primary responsibility is managing the behavioral health crisis system within our 5-county region. We cover Cowlitz, Wahkiakum, Pacific, Grace Harbor, and of course the county here, Lewis County. Our primary responsibility is our behavioral health crisis system, but we do fund other services. We have a 24/7, 365 behavioral health crisis line that supports the mental health and substance use callers that are in crisis. We have mobile crisis teams that respond to crises 24/7, 365, including a branch of that crisis team is our designated crisis responders that are responsible for the involuntary commitment laws and ensuring that individuals are assessed and, if needed, detained. Cascade Behavioral Health Care has been our mobile crisis team provider since we began operations. They do a fantastic job, and some of the data that I'm going to be showing next represents some of the work that they do. I don't have it specifically for Lewis County in the slide deck, but I'm happy to share information at any time. Just feel free to reach out. We also manage federal block grant funding and other state-funded programs, such as the Recovery Navigator Program and Jail Transition Services. We contract with Cascade for that as well, and Gather Church in Lewis County for some of those services. These programs, some of them were in existence prior to the ASO becoming operational. Some of them are new, and we've been learning and adjusting to meet local county needs.
We have a set of guidelines that we follow for our different programs, and one of our priorities is to look at having more local control over how these programs are administered and rolled out to our communities. We can go to the next slide, please. So just really quickly here, we have a year-over-year timeline graph that depicts calls that we receive in our crisis hotline. Columbia Wellness out of Cowlitz County is our crisis line operator. And these are all the calls that they receive by month, year over year. As you can tell, the blue line, 2022, we've had an increase of calls at the beginning of the year. In July, the 988 behavioral health hotline became operational, and as you can see, we're starting to see a decrease in calls to our regional hotline. For Great Rivers ASO, our main concern is that people have a place to call, whether they, regardless of what number it is. So if it's 988, call 988. If it's our regional hotline, who people are familiar with, continue calling that number. We will continue operations or continue operating the regional hotline, and it's our understanding that the state will support that service because they are aware that healthcare authorities are aware that we need local resources that know the local communities, the local community partners, and resources that are available. Next slide, please. Oops. 30 seconds. Okay, mobile crisis team data. These are graphs of data that our mobile crisis teams, we've collected for our mobile crisis teams. Oops. Failing today. I'm out of time and my phone's ringing. Client served, client service hours, count of services. We have seen an increase in clients served. Next slide, please. Detentions, ITA detention. This is the data that represents when individuals are involuntarily detained. This is the number of detentions that happen. There's a lot of work that goes on with detaining an individual, and we've seen an increase in 2022. Next slide. I put it in here twice because I wanted to stutter and really just show that it's a big issue. I mean, there's an increase in people needing that level of service, and our teams are doing a fantastic job of addressing all of the needs as best they can. Next slide, please. And this is my last slide outside of my contact information. But our priorities are just to integrate our response with the 988 and continue working to enhance the services we have, not replace. We want to enhance the services we have and support our behavioral health providers like Cascade Community Healthcare. Workforce is a big issue. We need training programs that build pathways into the workforce, and really that's what's going to be that's what we need in order to support the increased demands. Everyone talked about adding staff. Well, we need trained staff that can provide the service. It takes time, and we just appreciate your support. And there it is. Last slide. Questions?
They do have this slide, and we'll get it out to the family.
Are there any questions?
Can you fund the Youth Advocacy Center?
We have federal block grant funds. It is very restrictive, and Medicaid funds. We do have some general state funds that are more flexible, but the primary purpose is to support our crisis program. Any other questions? All right, well, thank you all.
We got one of those that are front desk and make us really upset. I'm Ruth Gutierrez. I'm with the Housing Resource Center from Lewis County. I'm the director. We have the shelters in our community, so a kind of quick rundown of what we do. First of all, I've been doing this since 1991. Kind of crazy. But We have the two shelters in our community. We have a family shelter and we have a single men, single women shelter. Family shelter, we have 6 rooms, 24 individuals. So how individuals in that shelter, and our single families, our single men and single women, 26. So we're really small, but we try and make a great impact on our community, doing diversion, creating housing stability plans. We've lived with these people, not these people. We live with our community members, addressing and dealing with their barriers to moving on to permanent supportive housing. We work with our stability plan, addressing any kind of issues or concerns they might have. We work with many. We have the Navigator program that actually comes to our shelter. We have employment that comes to our shelter that kind of addresses. It's a meet and greet situation. So our shelters are basically a place where we're communal living. So they share the kitchens, they share every space that they're in, except the families and the single individuals have a room that they can go to and they can shut the door. The one part of our men's shelter, that is not a situation that they have, unfortunately. They live congregatively. It's kind of like they're in a bunk situation. So not only do we do those programs, but we have rapid rehousing programs, which are those programs that will help pay either a very shallow subsidy when they move into someplace, or we can do ones that are long-term subsidy. So we have a youth program from 18 to 24 that they can be on a subsidy and work with supportive services for 24 months. We have one also that's a rapid rehousing program that we do for just families, and they can have a 2-year subsidy program as well. Hopefully we move them on before 2 years, but sometimes it takes longer, sometimes it takes a shorter period of time. So we're working with individuals who are literally homeless, so they're coming from the street, living in their car, a place not meant for human habitation. Those are the individuals that we provide services to. We are fed those individuals through the coordinated entry system, so it's not like it used to be when I started doing it, somebody knocks on your door and says they need shelter, they can come in. It doesn't work that way anymore. They have to go through a system of care, and then in the system they're kind of evaluated to determine their priority as far as shelter. And if they don't go into shelter, then that organization, Salvation Army at this point in time, will find other resources. Or they'll refer them to our resources within our community. So my organization is completely, all the individuals who come through our services, through our doors, come through coordinated entry now. So not used to be that way, but now it is that way. So right now there's probably in the youth program 18 to 24, there's 8 households. So those are individuals who are either in school, high school. We have a couple kids that are in high school who are actually getting supportive services while they're attending school and finishing school. We have individuals who have maybe been in mental health court, drug court, the Navigators program. Those kids have to enter that program who have severe barriers to providing, maintaining services. So both the family program and the youth program are a federal program. So I have to abide by federal rules to get them into the program. So it's not just, we would love to be able to serve whoever comes in our door, but we can't because we're mandated to do particular services. And those services are wraparound services that we're all kind of talking about. So, I like your statement. Every homeless individual that you meet, why and what brought them to this choice. I was somewhere once and somebody said, you don't just raise your hand and say, oh, when I grow up I want to be homeless. It doesn't work that way. Circumstances happen. Maybe when I first started doing it, it was like economically, in the 90s, things happen to people. Now it's completely different. So you have to learn a different game plan. And each individual is not a cookie cutter. So each one of my case managers has to work within that parameter. 30 seconds. We also do the Housing and Essential Needs Program, which is a program that the state mandates. The state feeds us people through. We don't choose those people either. They are qualified through DSHs because they have a disability of some sort. And that disability is determined by the state, not by anyone else, but they go through an assessment process. They qualify for HEN. We provide the service to them. That includes rent and utilities or in-support services as well. I don't know if I forgot anything. Did I forget something, Meja? I don't think so. Anyway, question.
Yeah, I'd like to know, in a calendar year, are you full most of the year?
Yes, sir.
What's the rate you would offer to?
During summer, it used to be that people used to like to go camping. Like I said, I started doing this in the 90s. Now, it doesn't really matter. We're full. We have people, the fastest that the coordinated mentoring system can feed us is the fastest we keep them. And right now, we're at a state where we signed a new contract that we're 90 days. So we're back to that rule again. So they get to stay for 90 days, and then we have to figure out what else we can do with them.
Thank you.
Yeah.
So with the coordinated entry, and I think I know the answer to this, but does the system track where the homeless individuals are from? That would be my first question. And two, are you finding that there's more success with those you're helping who are from the community because of familiarity, or is it not?
I don't know. The coordinated entry system does track. They ask if they're chronically homeless, so if they've been consecutively homeless, there's a little rule to that. And also where they came from or where they last stayed. So most of the people, we find people who are traveling. This is the odd question that everybody asks. Well, did they come from here? And it's like, there's a reason they came here. They either had a family member, maybe they didn't grow up here, but maybe they had a family member that moved here, that was support for them, and they moved here for that. Or, they lived in our community for a long time, and then they just kind of surfaced it up. They're our community members, and, no matter what, I was always taught you gotta, help those that you're supposed to, and that someone asks, and they're my community members, so that's what we do. And my staff, we all look at it the same way. It's like, maybe they didn't come from, we often ask that question, because we're curious too. It's like, what brought you here? Because Lewis County's kind of like different, we're vast, we're farmers, we have different things going on, so what brought you here? And it's most of the time it tends to be that my auntie was here, my uncle was here, I had a brother that was here, or somebody who was not my blood brother or my blood sister, but they came here. So I came here to get support. So they're here, that's what we do. And
well, my question wasn't whether or not you help them or not. The question was more geared towards, do you find that folks who you may find homeless locally are more amenable to the services here? Are they more successful? Is there a way to, well, the look on your faces is proving to me that maybe we're not being successful.
No, we're being successful. I don't mean to be, snarky about it, but it's like, I think we're providing and we're doing the best that we can with what we have in our community, and everybody's working really hard. And I don't think that we have anything better or worse than anywhere else. I think that, we're I worked in Thurston County for a really long time. We have a different type of a community. Like, everybody was kind of saying, you're kind of more centered, and we kind of look at people differently, I think. And maybe people feel that and they see that, and maybe that's what they're drawn to. I don't have an answer.
Yeah, because I know from Olympia's standpoint, you hear a lot that we talk about community care and community treatment and community services and treating back in the community. So that's kind of the center of my question is there any truth to that? Or does it not matter where you're from and where you receive services?
I think if you have a connection to the people that provide the services to you and the people that you associate with and the new population of individuals that you've grown to be with to reduce your barriers is what you're drawn to. If you find, and I think we've had that conversation, making a personal connection with people, maybe we're better here, maybe they're better at somewhere else. I don't know.
I guess I will intervene because that's what public health likes to do in everyone's life.
She does it.
But as a community, what makes you a member of a community or a citizen in a community? If you're a member, you're there. You're just there. If you're a citizen, you're actively participating, right? So homeless services are around chronic homeless, family homeless, youth homeless. All of those people can either be transitory homeless, so that's oftentimes people we see along the freeways, or, hey, I didn't notice that guy before yesterday when I was driving. Commissioner Slope often calls me and he's like, hey, I saw a couple new people I haven't seen before. Yeah, that might be a new person who's either transitorily coming through, they got stuck here, or bussed here, all those things that we hear. And yes, in my opinion, if someone is from here, the goal of wraparound services is to reconnect them with their network. Everyone in this room, you know, from Michaela, who worked with me on a prevention team, to Chief Denham, who has just done some awesome things for Special Olympics and other stuff, that connective tissue is what allows me to reach out and ask a question. So that's what we want to rebuild with wraparound services. And so I will say it is hard for a provider to say. It is easier for someone to be successful if they can rebuild that network. So if someone is coming from Packwood and used to call it going out to town into Centralia and only went once or twice and now all of a sudden is in homeless in Centralia, they're not going to have that network. So if we can reconnect them with someone who they may have known from Packwood, that's going to build that rapport. Why do people go to church? They want to express their faith and be around others that believe in the same and to build a community. That's networking. We want that network to be successful. So yes, I will say on the record, people who are local, who have that somebody they can reach out to, maybe that diversion is one thing we talk about. Diversion means we're diverting the person from homeless. They called coordinated entry and said, my auntie's going to kick me out in 2 days. I don't have any place else to go. My mom moved away with her new boyfriend, yada, yada, yada. Okay, we want to divert you from being homeless. Here's a program that will maybe pay your auntie $250 a month to pay the utilities, because we're keeping that network. Now, someone who's burned their auntie a couple times and the Navigator program is now working with them, the intent is to say, hey, counselor, come meet with me, tell me what I can do to make my life better. I'm going to give that a try. But if that doesn't work, who's the next person I might be able to reach out to? So, yeah, bluntly, I think people local will have a better success rate. And I've seen it personally. Some of our veterans who Heidi's going to speak about, who are homeless, reconnecting them with their family members or somebody they served with, and peer supports. I'm going to stand on a little soapbox here. Peer supports are something where someone who is similar is walking alongside them. I can't walk alongside someone who's served in the military and tell them what to do. My grandfather, my father, my brother, my uncles have served, but I have not served. So I can't give them example to spark that interest to motivate them. I can't also motivate them by telling them, you're going to quit doing drugs and you're going to stop hearing those voices in your head. Nope, not the way to do it. How to do it is to say, I'm here when you're ready. But if you're not ready for a house, okay, let's talk about another option. And that's what wraparound services, case management, and counseling is supposed to be.
I do have another question, or a question for you, is that I agree, I've heard all the rumors. I don't think I've been to a forum yet where homelessness or trans people are talked about, where it doesn't come up that, well, these people are being bused in, they're being brought here, and I think that's probably it's a rumor, but it was also said that all of a sudden new people show up that we've never seen before. And I also agree with Meja, when one of the best things you can do is have that wraparound system for people's mental health and to be able to get into a recovery program. That being said, is that when we do come across people that are not from around here, and maybe their support network is in, say, Colorado, or maybe it's in Florida, or wherever they may have come from, and they ended up here somehow, regardless how they got here, do we have plans on how to reunite them with family members that's workable, to help provide them with the best care that we can possibly give them, to reunite them with family?
There are a couple of local churches, and we do find that, and people are just like, man, if I could just get home to where my family is. And we've had people who are family in our family shelters that's their goal, to stay with us until they can get somewhere else. And there are a few local churches, and there are a few, different little pots of money, and my case managers, and we all kind of look and see what we can do to find them where they need to go. But there's not one set fund that can do that now. It's a piece work of stuff. And asking their family members, their aunties and uncles, all those wonderful people.
Well, I had a feeling that's the way it was, because that does not sound very efficient to me.
No, it's not efficient. Because there's no one stop, and that's what we do at our organization is we kind of do that wraparound, and we put all those pieces together for people that can't actually put that puzzle together. So we're there and we walk with them, like he just says. We don't lead anybody anywhere. We give them a path and we say, this is a path you can take and we can walk with you and help you through that path. But I can't do it for you.
Sure.
So, yeah.
Track. And our sheriff department had to leave shop with the cop. So we'll just continue.
Good afternoon, everyone. My name is Sherri Coleman, and I'm here to tell you about NAMI Lewis County. And we're going to start with a slide that describes what is NAMI, and then I have a couple slides to show you and tell you what we're doing locally.
Okay.
17% of youth ages 6 to 17 experience a mental illness.
I joined NAMI because I have two sons that live with a mental illness, and I didn't want any other families to feel alone like I did.
At NAMI, the first thing we want anyone to know is you are not alone in your mental health journey.
I just really want to talk about it so people know that you don't have to go through it alone.
NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization, dedicated to building better lives for the millions of Americans affected by mental illness. We started as two moms, gathered around a kitchen table in 1979. And today, we are an alliance of more than 600 local affiliates and 48 state organizations who work in your community to raise awareness, build advocacy, and provide support and education. NAMI envisions a world where all people affected by mental illness live healthy, fulfilling lives supported by a community that cares. Every year we are expanding, no matter race, religion, age, or sexual identity. We are people with lived experience, families and loved ones, survivors and advocates. And together, we will fight the stigma surrounding mental health and create a better world for the sake of all of us. We have resources for you and can't wait to become an extension of your family. We're here for a healthier world. We're here for better mental health. We are here for each other. Join us.
All right. Could we have the first slide, please? So what is NAMI? Essentially, this slide is just a summary of what you just saw and heard on the video. NAMI stands for the National Alliance on Mental Illness. And NAMI Lewis County is the local affiliate for the National Alliance on Mental Illness. And we provide the same programs. The National creates the programs, we provide them here locally. We are a nonprofit, and we are a provider of mental health services. But we are unique and very different from other mental health services in a number of ways. First of all our programs are free. There's no cost to the participant, and you don't need insurance. It's free. Number two, all our programs are peer-driven and led by trained peers living with a mental illness or family member with a loved one who has a mental illness. And we provide support, education, advocacy, and community awareness. Number 3, the teachers, facilitators, and presenters of all our programs have a lived experience, so they know what people are going through. And we're not social workers, we're not therapists, but we do have a lot of members that are professionals in the field. And finally, number 4, people do not have to be a member of NAMI to participate in our programs. We try to keep it as accessible as possible for anyone that needs us. Next slide, please. So this is a slide with a general outline of what our local programs are here in Lewis County. We've been here since 1997, I think. So quite a few years, and started out with just a few people, and we've built capacity and continue to provide, first of all, support groups, and we find that very, very important because this is a place where people can share experiences in a confidential setting, and it provides hope and a sense of connection for people. And so we have support groups for not only people with a mental illness, which we call the Connections Recovery Support Group, but we also have support group for family members who have a loved one. And all of our programs are kind of family-based. That's the basis of our origins, as you saw in the video. And we always include families whenever we can, because research has shown that recovery outcomes are much better and very improved for someone with family connections. And trying to go through a mental health challenge with no support and no one that cares about you is really hard. And at the same time, it's really hard on families to maintain that support and help their loved one. They don't know how, they don't know what to do. So that's what our programs are designed to do. And so in the second section, we have educational programs, 30 seconds, peer-to-peer, and family-to-family programs. Those are 8 to 10-week courses, they're free. We also have community awareness presentations. We have an In Our Own Voice presentation where an individual with mental illness talks freely about what it's like to live with a mental illness. And we like it to be interactive, so the audience can participate by asking questions and really learning what it's like. And we also have a new president, Abe, and he's very enthusiastic, and he's available anytime to come make a presentation to your group or organization if you want to learn more. And we just can give him a call. Next slide, please. And this last slide is just my contact information. Feel free to call in anytime. Our email, and we also have a website. And our website has a very good little contact us page where you can send us an email about whatever's on your mind, and it's just automatic there. It just comes straight to us, and we'll try to get back to you as soon as possible. Questions? All right. Thank you.
Hi, I'm Angela Bennett. I'm the director of CCBHC and accreditation here at Cascade. I want to thank you all for coming and the amazing work that you've done over the past year, legislatively to get some behavioral health funding, specifically focusing towards the CCBHC. History on the CCBHC, which stands for Certified Community Behavioral Health Center. It was created in 2014 federally. Started with 8 demonstration states. Currently, there are over 450 CCBHCs in 42 different states. However, every state has not adopted a CCBHC payment model. There is legislation in place currently that allows every state the option of joining the CCBHC Medicaid demonstration and investment. And they handed out grants
expansion grants, and Cascade received one in 2020, and then this year we were granted the Advancement and Improvement Grant, which is a 4-year grant. However, the funding for the 4-year grant is half of what the original funding was, and so that puts a big kink in the CCBHC model. So I'm asking for your support to continue to move Washington toward the CCBHC state. What does this grant do? It allows for us to improve community-based integration, evidence-based practices, person-centered and recovery-oriented care, while being trauma-informed, culturally competent. The funding opportunity has opened up partnerships with many in this room. Also not present today is Valley View, which is our local FQHC. We have a care coordinator in place that actually coordinates chart notes and treatment for people that use their primary care services and our behavioral health services. This grant has also allowed Cascade to open our own primary care clinic. It's a one-provider clinic. We see probably 18 patients a day. We all know that primary care is in short supply in Lewis County, and so it's been a big job for our clients that have a hard time navigating other systems. Secondly, Cascade has been able to open an MAT program at our SUD clinic, and Mindy will go into detail about that. We've seen many improvements over the last 2 years with the national outcome measures. These include a 15.2% increase in overall health, a 59.1% increase in improved functioning in everyday life, and an 18.7% decrease in serious psychological distress for clients that are participating in our grant. The objective is for us to become self-sufficient, and in order to do that, we implore that Washington State becomes a CCBHC model with a pay-per-service or a spending system. Currently, we can't. A lot of the work that the care coordinators do is not reimbursable through Medicaid, and so the grant funds those positions, but in order to continue to be able to do that work, we need to be able to collect for their services. Any questions?
How much is the grant? How much is the grant?
Our current grant is just $1 million a year for the next 4 years, and we are able to use that for staffing support, for client needs, and other things. We've purchased a transportation van and hired a driver. Our grant before was $2 million a year, which allowed us to focus a lot more on client needs. So we've been working with the HCA through the CCBHC exploration, and we did receive some bridge funding from them, so we're still able to provide those client need services using that bridge funding.
How many is that grant through the CCHC or the CCBHC?
The CCBHC is the $1 million grant, and then we received $370,000 in this HCA bridge funding.
How many organizations like this in the state?
15.
So it's a $15 million problem statewide?
At least.
Okay.
Not all of our original grant expired, so there were 3 original grantees, and so the 3 of us, our grants expired in 2022, and so then as the others expire, then they'll be moved into the lower.
If this is funded, do you expect there'll be more of these?
Yes. It allows for multiple opportunities for wraparound services and transportation, and just today I was able to approve $100 to help somebody that's in the HID program pay their power bill so that they, can.
Sorry. Thank you.
If I start from the back here, can I have a little bit more time? Don't start the clock. My name is Christian .Bruhn. I'm with United Way of Lewis County. Just finishing my first year. It's gone very quickly. I thank you all for being here to listen to all the great work that's going on. United Way of Lewis County is working to get families out of poverty by 2030, 30% of those families. That's something that when I was a board member for United Way, which I was previously, we came up with that bold goal. And we were looking at strategies to be able to get those families out of poverty. My background is in higher education. I was at Centralia College for 7 years as the dean. So moving that education background into the United Way forum helped me kind of understand an idea of working towards supporting education programming in Lewis County. So our strategic initiative is from cradle to career and beyond, supporting programming in 5 different sectors: early learning, elementary reading and math, middle and high school success, college and career readiness, and then continuing education. Sam mentioned the program, the educational program that she's running. We're working with her to help support that. So the nice thing about education is that we can hit it at so many different levels. So to be able to ask for support from our legislators is to help identify the barriers that are present. The programs we already have up and running are the Dolly Parton Imagination Library, which Representative Barlow has been a huge help in that. Also, our Reading Buddies program is bringing volunteers to come in and read with kiddos to be able to get them up to that 3rd grade reading level. Supplies period is providing period supplies for young ladies so they don't miss school. One of the big things that I'm looking towards now is a tutoring center for the entire county. Something that we can support a vast county, a rural county, to get information to the students, just not on math and English and sciences, but also how to get to that career. Is college the next step? Is apprenticeship the next step? What things do I need to do to get to the career that's going to help get me out of poverty? So we've talked a lot, JP talked about it, Sam talked about that upstream piece, the preventative piece, is education. If we can help remove the barriers to education, we can help support our students, our kids, from youth all the way to a lucrative career and then beyond. That's the continuing education piece. So there's a lot of programming that's going on in United Way, and the support from our adult legislators and our community has been amazing. Something that United Way also does is we bring people together. We have a community partners meeting every quarter, and we have to get a bigger room now because we had 40 people at the last one, and everyone shares what they're doing, and we make those connections through a lot of nonprofits. So I see a lot of people's faces that are there, and if you're interested in being part of that, let me know. We'll add you to the list because we are going to look for a bigger venue for our winter meeting in February. So, good? Good. See? The extra time help. It gives an update of what United Way is doing, but also that education piece is something we want to be one of the major hubs for helping remove barriers. We're working with the college now on the federal the financial aid piece to help students understand that financial aid is out there. Has anyone filled out a FAFSA before? Right? Does it you know what it stands for? You can raise your hand. That's fine. That's interactive. What does FAFSA stand for?
Free application for federal student aid.
It is, yes. A lot of people don't know that. And if you don't even know what that means, I mean, can you imagine filling out that form and how daunting that can be? So we're working with the college right now to help get that word and that support out for students. So that's just another program. So the idea for this forum is to say to our legislators, what barriers are there and how can United Way help too? We're not just asking for money, but how can we support the ideas that are coming up? So that's what I leave out with United Way. So any questions? All right, thank you.
Good evening. I am Heidi Palmer. I am the Veterans Benefits Specialist for Lewis County. I work for Lewis County Public Health and Social Services. So I work for the Veterans Relief Fund. We provide emergency financial assistance to our veterans, low income, and those who are indigent. Something that, we're all here talking about behavioral health. We have partnered up with the Lewis County Veterans Memorial Museum to start up a peer program. And that is with Jesse Lloyd and starting Veterans Journey Forward. So that provides that peer program that some individuals have talked about. As a certified peer support specialist myself, it's extremely beneficial for our veterans. I use it day to day with all my clients. You'd be amazed on how beneficial it is. I've had spouses call and say, well, my spouse is a veteran, they won't apply for services, they won't apply for benefits, for disability or compensation. So go ahead, bring them in, we'll chat, just have a conversation. The great thing about peer support is you can do it anywhere. You can go on a walk, provide peer support, do it in the office. So thankfully it has been extremely beneficial for my program. Providing these services to our veterans, because with that it has provided veterans with extra income to help them be stable provide that extra support financially for their family, but also receive that extra benefit of receiving mental health services, receiving those other services that they deserve. As a veteran myself, as someone who has utilized mental health services, it is great to have another veteran to talk to. Veterans, we're not cookie-cutter people. Just because we're all veterans, we're not the same. We don't have the same experience. There's those who may, have deployed or who have not. So we can't use the same mental health services across the board. This is one thing that's great about peer support. Not everybody enjoys sitting in a clinical setting either. It's not one size fits all. Another thing that's great, Cascade utilizes a peer support for our veteran community as well. I would really encourage and hope that more providers are able to provide that peer support or any mental health service to our veterans. We don't have enough providers. Not everyone can go to Olympia and see Ruth. Not everyone is comfortable with telehealth either. I'll be honest, I am not. It is not enjoyable for me. I like to have a one-on-one. We are also, as providers, we're all here talking about housing, as I mentioned. Veterans, as you mentioned. I think as providers, we're all here for the same thing. We're here to provide services to our community as a whole, not just certain individuals. And I think that's why it's great to be able to network and support each other in our programs to be able to provide those services to our community as a whole. We all don't have the same story. We all have different stories. We all come from different backgrounds. That needs to be supported. We need to be compassionate and empathetic. You'd be surprised in how far that goes. That compassion and empathy. I would really encourage, if anybody has questions, if you would like to, come to my office, even sit down, I'll make you a cup of coffee, and we can chat about veteran services. We can talk about what I do in our program and what other services are provided. Maybe share some stories. Okay, another 30 seconds, so I'm good. About what, the success stories that we've had. This community, I'm not from here. I come from a military background. When I came back to Washington after my deployment, started out in Thurston County and migrated down here and been here since, for a while now. And I appreciate everyone who is here to listen to what we have to say, to hear hopefully what we can do better within our community to provide their services for everyone, being inclusive. So yeah, any questions?
What about healthcare for veterans?
Sure. So the great thing about healthcare for veterans, which I'm super excited, I just found out yesterday, is for those veterans who are in East County, Arbor Health just came on board with the VA, so they are able to provide their services to those who are going through community care. So that is incredible. So that means contacting your primary care provider and getting that community care and not driving an hour and a half to Olympia. And if, for some reason they're not able to do that, my program actually provides free transportation for veterans to their appointments. And that can go from anywhere, all the way from to Seattle, down to Portland, wherever we need to go, we'll take them.
Heidi, our primary care provider is also critical to healthcare, so we can see that.
Excellent. Excellent. Any other questions? Anything here? Super. Thank you. I'm the last speaker, so I'm second to JP.
So I'm Mindy Greenwood. Since we last spoke, I have moved on to the executive team with Cascade. I'm now Chief of Inpatient Services and SUD. So I will be talking to you a little bit about some multiple things here. The biggest thing that I really want to talk to you guys about is we've been saying for the last couple of years about how our SUD residential was coming, how we were so excited. We seem to just get there and then we get yanked back and drowned a little bit. So in 2019, we were awarded from the legislature $750,000. Then COVID hit. While COVID was going on, we were doing a lot of research of what we could do. Were we going to do a whole new building? Were we going to remodel? What were we going to do? Well, we landed on that our 135 West Main Street, we're going to remodel, make the second floor inpatient, first floor's outpatient, MAT, full meal deal there for substance use. Had a little issue with City of Chehalis because during COVID they paved the street. They didn't want us to cut into it, but we got that worked out. And in June, we started working with CRS and DOH, and we have come to a standstill. We had started asking them a couple of years ago if they would do an emergency ruling for an R4, and they at that time told us that they did not see a problem with it. An R4 reduces the cost because I can build it to residential coding instead of institutional coding. SUD residential treatment is community living. It doesn't need to be built like our ETC was built. So in June, we sent an email to try to do this. We did not hear back from them until the middle of October. No response back to them from many emails. They had a meeting on 11/4/2022, and in that meeting, they decided to table the emergency ruling, and they also did not let any public comment happen. They decided to have a subcommittee formed, and the people that will be on the subcommittee were the people who tabled the emergency ruling. So we went into that emergency meeting with letters from King County, Kitsap County, Thurston County, the governor. We had everything that we needed to support this. But to put this simply, why we need this, Washington State is the only state in our nation that does not follow the R4 ruling. So this is hindering multiple behavioral health agencies being built so that we can address some housing issues. For me particularly, SUD. They are in there for almost 30 days, and during those 30 days, we're working with them to find housing, to find employment, to help them with their substance use. So this going on, I probably won't even get to start this now for another year. So that's a year's worth of people that I won't be able to work with. So that's our biggest ask, is if there's anything that you guys can do, and if you need to talk to me, I have a lot of emails that I can share with you. I know Representative Marno, we talked months ago, which we thought we were going in the right direction, but it didn't. So that's our biggest thing for SUD. We really need to get that up and going because it's important. It's something that is needed. It is something that will help with all of this stuff that everybody's been talking about. It will help with homelessness. It will help with mental health. It will help with employment. So this makes our community healthier. And it really works with what we do with JP and Choice with the prevention. I'm the one that has to do the treatment, and so I need the tools to be able to do the treatment. And I don't have it right now. We did touch a little bit on MAT. We started the MAT program with the CCBHC. They paid for our provider. We are currently at 50 active clients in our MAT. Our MAT did start off a little bit slower than others because we do have requirements to being in that program. It's not that you just hit to come and get your Suboxone. You have to be in treatment. They may not go into treatment at the first appointment, but they're usually within treatment within the first couple of weeks. We do have a walk-in clinic, so they're able to come in within 24, 48 hours to get in on MAT and or into substance use treatment. But they go hand in hand. We can't just hand them a medication and expect that they know how to change their behaviors. So we are there to support them with that. One thing that we would like with SUD2 is peer support is wonderful, and I love the idea of peer support. You got to put it in the state plan, and you got to change peer support to be, it can only be provided after the assessment is done. Peer support really is about engaging the people. It's about having people who have lived experiences engaging people into services. Right now, how the state plan reads is you can't do peer support until after the assessment is done. Well, once I have the assessment done, we kind of already have them going. I need payment for all the work that we do, the hours we do getting them there. So that's what I have on SUD. Moving over to inpatient, our ETC, we have the 16 beds. We do involuntary treatment. There was an article that came out this summer in King County that really talked about how evaluation and treatment centers don't take medically compromised clients. But there's a reason for that. We are not set up to be a medical facility in any way, shape, or form. We do have some primary care that will come in and deal with issues that arise. I know that it's hard on the hospital, and we try to work very closely with them. We try to get them out of the hospital. I mean, if we have a bed and we can take them, we try to get them out. But the other thing is that medical clearance to ITA somebody, you're taking away their rights. So I would rather that they have this medical clearance to the hospital and all the tests, but it truly is not a medical issue. As simple as this sounds, a urinary tract infection in somebody who's older can also mimic behavioral health. We don't want to take that person's rights away and lock them up because they're having a UTI. So we have to have these medical clearances done if we're going to ITA them. Discharging from inpatient. I am sitting on a call tomorrow because there's a new bill that's coming through. I can't remember the new bill. I just got it this week. About when you discharge from inpatient, we have to work with MCOs on housing. We've had a great debate already on housing. I agree, we need to find placement. I will tell you, for me and my discharge coordinator, not being able to use Housing Resource Center except through coordinated care is a hindrance. Because what happens is if I have an ITA person and we go into court on Tuesday at 1 o'clock and we're expecting to be able to keep them for another 14 days, but the defense attorney and the judge disagree with us, they give us an hour to get them out. We now have no way of coordinating through coordinated care. We're like, here's some information. Like, we have to let them out. And that's what we can do. So anything that we can do around discharging to really help around, even with the ITA laws, it would be nice if the judge says, no, you're not going to keep them any longer, but here's 3 hours. Take 3 hours to get them out. That gives us a little bit longer to make some phone calls. Just a little bit. So yes, finding a place to discharge people out to it's a hindrance for inpatient facilities. Not only that, we have to get them back to their county of origin because we take people from all across the state. So I got to figure out transportation. I got to figure out where they're going to go. So I'm just throwing that out there. The crisis stabilization triage unit. It's where everything is moving towards in the next year. The 23-hour model with the living room model is wonderful, and we're moving in that direction. So that means that clients can come in if they're having a mental health issue or crisis. They can come over there to us there. We will see them through nursing, and they will do a nursing assessment. Darin, hopefully you like this. We will assess them, and if we feel that we can maintain whatever's going on with them and then we don't think there's a higher medical issue going on, we will take them. We will not send them to the ED. If we feel that they have a higher issue medically, then we will refer to the ED, their primary care, or our own primary care. I haven't pulled the trigger on this yet. This is something that's coming in the new year because I'm putting the staff together, but we're right there to do this. The only thing that's hard to figure out, I've had brief conversations with Chief Denham, is when we do this crisis triage thing, one of the things that I would like the laws looked at to help clarify stuff for law enforcement and for us is supposedly law enforcement is able to divert and send them to me for 12 hours to hold, which is fine, except for they're only on a hold. They're not detained, so I can't force medications on them, and I have to wait for the DCR to come down. But that being said, if they go sideways on me in the CSU, I need to be able to call law enforcement, and I think there's confusion around there about law enforcement then taking them to the hospital, where, weird as it sounds, the hospital has more ability to force meds on them in there than I do in the CSU, but they'd be involuntary. So those are the major things that I have. Did I do under 5 minutes? No. I oh, let me keep going. No. Yeah. Do you have any questions? That was a lot. I know. I was nervous, but I told Richard, I'm like, normally I do SUD, but now I've got these other. He's like, do them all. Why would that?
Okay, I do have a question, more of a statement and a question at the same time. Is that you brought up the issue about transportation, and I know that that is something that has kind of boggled everybody for a long time on what you do with transportation. I know the hospital suffered with this and trying to get people to treatment, and they can't get them out of the hospital beds because there is no transportation. It's either by ambulance, and they're usually tied up. And law enforcement, we're not geared up to do that kind of transportation for medical reasons. So is there something out there, and I know there's laws that govern what kind of transportation. I know that I talked before about Cascade being able to do transportations and actually purchase one of our old patrol cars to do that, but apparently that was restricted because of liability, because of the laws. When there's a cage and safely transporting, you have to have a certain amount of medical staff on board, even when you're transporting for non-medical reasons, except maybe just mental health. So the question comes is there anything out there that, and I guess I ask this panel here, that can be changed and can be addressed, that we can actually have civilian transporting people to get them to the services they need? Because a lot of times I know that they leave the hospital in hopes they show up at services. And as far as I'm concerned, that is completely unacceptable and not a good practice, because we're not servicing the people that need to get those services.
So Senator Orcutt, we had a meeting a few months ago, I think now, where we talked about secure transportation and what that meant and what we needed for that. In our law around ITAs, for the behavioral health ITA, it does specifically say secure transportation is by ambulance or law enforcement. Doesn't give me any other options in that law. But then your guys' laws, and that's where the confusion is. So I don't know.
And that brings up the question, because I know there's been conflicting laws that recently came out that I say that lightly, but it's a genuine concern, because I know still there's law enforcement agencies, even locally here, that will not do transportation, nor will they even go out to locations where someone's having a mental breakdown. Fire departments won't even respond, so because they're not getting the law enforcement support and safety that they need. So that's very, it's a cyclical problem that nobody's helping, and people are suffering. And it's obviously something that we have to address and get it clarified one way or another, so that we no longer have these issues.
It was here.
Fair enough.
Thank you, you guys.
So thank you everyone for coming. We do have a few minutes if we have questions from the audience. No questions. Well, let's give our presenters a hand. A wonderful panel of experts over here. We're going to go row by row through the line there to have some food. Otherwise, I have to take it home. So, thank you all for coming. Appreciate it.